For the past 4 years, when I first came here, I could hardly walk. Hardly walk. Hardly walk. Hardly walk. Hardly walk.
Hello, I'm Roberto Cancel, and I'm here at Advanced Pain and Wellness Center in Jersey City, New Jersey. I'm sitting with Dr. Christopher Samaniego, the podiatrist here at the center. How are you, Dr. Christopher?
I'm doing well, Roberto. Thank you very much.
Okay, so can you please share a little bit about your background and what led you to specialize in podiatry?
Podiatry is the field of foot and ankle care, and I got drawn into podiatry because it's a beautiful balance of surgical skills along with a balanced clinic schedule, a work-life balance with family life, and just being able to help my patients get back on their feet at the end of the day.
Okay, so how long have you been practicing and what changes have occurred in the field during that time?
In October, it'll be my 6th year practicing with this group specifically. Biggest changes that I've seen are a trend, especially in surgical skills, towards minimally invasive techniques, which has been a big plus for the recovery of my patients.
Fantastic. Tell me, what's your educational background?
Sure. I did my pre-med biology for my undergraduate studies at Messiah College in Pennsylvania. After that, then I did 4 years of podiatric medical school at Temple University, School of Podiatric Medicine in Philly, and then 3 years of surgical residency in Detroit, Michigan at Detroit Medical Center. After that, I came back to New Jersey to practice. New Jersey is my home.
Great. What type of patients do you typically work with?
I see adult and pediatric patients. A large part are diabetic foot assessments with my diabetic population. I also see a good amount of plantar fasciitis, tendon injuries, a lot of overuse injuries in athletes in the summertime with different marathon training and that sort of thing.
What do you find most rewarding about working as a podiatrist?
The most rewarding thing is getting people back on their feet and what they love to do. Our office is just down the road from the local high school. We see a lot of young athletes from the basketball, track team coming with different injuries and just getting those kids back to what they like to do, running around. That's the most rewarding thing to see.
Tell me, how can people prevent common foot problems like bunions, corns, or plantar fasciitis?
Some of it's going to be genetic, and unfortunately there's no escaping our genes entirely, but we can control our controllables, the environment that we put our feet in. So when it comes to bunions, our feet are wider and we're going to need a wider toe box or a wider shoe in general. So making sure we're not doing something that's accelerating the process, squeezing those bunions and making them even tighter, making sure we're fitting in the right shoes. Besides shoes are also inserts that we call orthotics, and the whole point of orthotics are to relieve some of the pressure points like bunions and corns and calluses, that sort of thing.
What type of shoes would you recommend?
There's no perfect one-size-fit-all shoe out there, but for a lot of my patients, I'll recommend a list put out by the American Podiatry Association, the APMA. They'll put a list of recommended shoes, and the 3 brands that I tend to recommend the most to my patients, I even give them out to my friends and family myself. I trust these brands: Brooks, Hoka's, and Asics. They just make good quality shoes, and for a lot of my patients, it helps them quite a bit.
Okay, on that note, can you explain what are orthotics?
Orthotics are inserts, and you could either get them over the counter, which fits most people, or custom made, which are tailored towards a specific patient and their foot type. For certain conditions like high arches or really low arches, it can be helpful to get something that's custom made rather than something that doesn't fit quite right over the counter.
Okay, and tell us how does overall health and age, like diabetes, obesity, or cardiovascular health, impact foot care?
Diabetes in particular is linked hand in hand with foot care because our feet are first affected when it comes to diabetes, especially when it comes to our circulation and our nerves. Numbness and tingling, cramping in our lower extremities and our feet are one of the first symptoms that can happen when diabetes starts to become uncontrolled. And that's one of the things that absolutely we can make sure we diagnose, we check up regularly, and make sure that you're on the right track.
So how do you determine if a patient needs surgery or if their condition can be managed with non-surgical treatment?
A lot of foot conditions can be managed without surgery, and conservative treatment always comes first before considering surgery. A lot of conservative treatments can include basic stretching exercises and making sure we're wearing the right shoes, and sometimes the additional support of orthotics. Sometimes anti-inflammatories, injections even, but if all else fails and you've completely exhausted all of these conservative measures, that's when we have a surgical consultation and talk about the different surgical treatment options. And like we talked about beforehand, now we're seeing more minimally invasive techniques and implants that are out there, and that kind of speeds along the healing process, the recovery process. It's been really helpful for a lot of patients.
And so during this diagnosis, do you diagnose their gait?
Yes, so if a patient comes in and says, Dr. Sam, I have an issue with my gait, gait is just a fancy word for the way that we walk. And not everybody walks just like the person that's next to them. We all have a different way of walking. Sometimes we'll compensate more towards the side that we have dominance on. If we're right hand sided dominant, we might shift a little bit of weight there. And that's one of the things that we can tell during a gait analysis. You come into the office and I watch you walk with your shoes and without your shoes, and it does change the way that we walk there. You can tell a little bit of difference in the way that your feet are supported with and without your running shoes and walking shoes. Sometimes it does need a little bit of additional support, like in orthotics. Sometimes it needs a little bit of physical therapy and just strengthening up certain muscles that are being overworked, overcompensated towards the other side. So those are two of the main things that we kind of focus on when we do a gait analysis.
So how important is stretching and strengthening the muscles of the feet and the lower legs for long-term foot health?
For long-term foot health. So a lot of my patients that have these chronic conditions, maybe they had an old ankle sprain that has been there for years and years, or keeps on rolling over and over. In those chronic conditions, it's extremely important to strengthen up the muscles that surround these ligaments and give that ankle the most stability it can. In some cases, it will require working with a professional like a physical therapist to teach you some of these exercises. But there's basic general exercises that you can do at home without too much specialized equipment to do. Some of that is some basic stretching. Some of that is using either a resistance band or a towel just to give you some resistance while you're doing some of these exercises.
And on that point, can you suggest some daily foot exercises or practices that can help people maintain healthy feet?
Absolutely. If you're an athlete or very active, make sure you're spending the extra 5 or 10 minutes after your workout to focus on whatever muscle group you're training that day. So if you're doing a leg day, making sure you're doing some calf stretches and quad stretches after you finish your leg day workout. If you're the type of person who's just getting back into establishing an active routine, then just warming your feet up at the beginning of the day by doing some foot circles and rotations, maybe some calf stretches and just some lunges against a wall with some support, just doing a little bit to warm up our feet at the beginning of the day.
So what advice would you give people who are on their feet for long periods of time, like healthcare workers, teachers?
Yeah, we see a ton of nurses, teachers, police officers, people who are working 8, 10, 12 hours a day standing on their feet. The biggest word of advice is invest in good quality shoes, because if you're standing on your feet for that many hours a day, then make sure that you're wearing something that fits comfortably for your foot and has that support for you.
So looking ahead, what trends or advancements do you think will shape the future of podiatry, such as 3D imaging or laser treatments or even AI?
Yeah, definitely with 3D technology, one thing that we're seeing right now is 3D printed implants from a patient's CT scans. So what we can do is from your CAT scans or your MRIs, we're able to 3D print your specific bone and be able to use that in surgical implantation. So it's tailor-made for patients. In terms of AI, I think it's been really helpful with physicians getting a little bit easier access to diagnosis and a little bit faster research, questions answered. I think it's going to be really helpful in just giving physicians access to some of that data.
Yeah, the more data, the better.
Of
right?
course, of course.
Yeah. So, lastly, if you could give people one piece of advice to improve their foot health for life, what would it be?
The one piece of advice I would give is listen to your feet. Your feet are your foundation, and it's important to build a strong foundation. Whether that means if you're an athlete, spending the extra time stretching, if you're that teacher or nurse that's on your feet 8, 10, 12 hours a day, wearing good quality shoes that feel comfortable for you, but listen to your feet. Pain is not normal, and being able to catch a diagnosis earlier and start treatment earlier is very, very important in long-term health and keeping our feet as healthy as long as possible.
Great.
Yeah?
So thank you. Dr. Christopher Samaniego is here at the Advanced Pain and Wellness Center in Jersey City, New Jersey. Come look him up if you have any type of foot pain.